Because the pain or bulge in your lower abdomen does not go away, there is a possibility that it might be more serious. It might be an inguinal hernia. So what is hernia? Hernia is a condition in which your internal organs protrude out through a weak spot in your muscle or the tissue layers. The hernias are of various types. The most common hernia is the inguinal hernia, which is seen in the groin. How does a patient present? They present swelling in the lower abdomen, which increases in size on coughing or doing any strenuous activities like lifting weight, and reduces. The swelling disappears on lying down or taking rest. Generally, it is associated with mild pain. On other occasions, if neglected, they can present with much more severe complications such as irreducibility, where the swelling does not go back on its own and patients present with swelling and persistent pain. Rare instances, they can present with a complication called a strangulation, in which the part of the intestine which is protruding out loses its blood supply and undergoes gangrenous transformation, which mandates an emergency surgery. So, who are at risk to develop a hernia? Any condition which increases your intra-abdominal pressure is a risk factor for developing a hernia. Male patients over age of 50, the size of the prostate increases and they will have difficulty in passing urine, which increases the intra-abdominal pressure. Similarly, patients with chronic constipation, chronic cough are predisposing risk factors. Smoking is also a risk factor since it affects the abdominal tone and the quality of tissues in the abdominal wall. Obesity is also a risk factor. As the age progresses, the tone of the abdominal muscle decreases, which is also a predisposing risk factor.